Mendocino County COVID-19 update. Today, we are pleased to be joined by Mendocino County Health Officer, Dr. Andy Coren, who will give an update on the COVID-19 status of our county. After that, we'll open it up to take a few questions from the media concerning the COVID-19 incident, limited to 2 questions from each media outlet in order to preserve the schedules of our staff. If time allows, we also take questions from the public. If you're a member of the public, please leave your question and comments on the video below, and we'll do our best to address it. Now, beginning the health update, Dr. Andy Coren, you have our attention.
Thank you very much. So we'll start with what's happening worldwide. COVID does seem to be decreasing worldwide, except in South America and Russia. And of course, there is a very bad outbreak continuing in India, but the numbers have decreased some. In the United States, also decreasing, with cases numbering 33,371,667, and the deaths numbering 597,840 at the time that I pulled the data, which was June 7th. Hotspots in the United States seem to be in the northern Rocky areas, Great Plains, Midwest, and Southeast, all with the low vaccine rates. In California, the daily cases, test positivity, hospitalizations, and death are the lowest in a year. The total cases now number 3,690,868, and the deaths are 62,473, with a test positivity of 0.7%. But in Northern California region, we have a significantly different picture with higher case rates, and test positivity is also significantly higher, running 2.9 to 8.5% in our area. Mendocino County is in a surge, and as far as case numbers, they're actually the highest in our region. The numbers of cases average 5 to 7 per 100,000 per day. These are concentrated in Ukiah, Redwood Valley, and Willits. And the test positivity is now 3.8%. Also note that these cases are nearly all unvaccinated. So the surge is among the unvaccinated, 45% over 12 years old, which means that the case rates among the at-risk is really much greater than reported for the total population. Also, please note, the vaccines are working. Our testing rate has fallen to only about 170 per day compared to over 400 a day 5 months ago. This limits our ability to estimate case rates accurately and also to contain outbreaks. In the hospital, we have 5 on med-surg, 1 who is pregnant, and 1 is in UC San Francisco. And we have 2 in the intensive care unit at this time. These hospital cases have also increased, and again, because of low testing numbers, these may be a better predictor of how significant the surges we are in. These numbers are very similar to the winter surge. The deaths in our county now number 50. Last week, we had the latest death in a woman in her 80s after spending 3 weeks in the intensive care unit. Our total cases are 4,258, of whom our Latinx community has suffered 2,056. Currently, we have no outbreaks associated with businesses or schools, but we're seeing a lot of community spread. And we have several troublesome high-risk exposures that are illustrative examples, and I want to review those. Recently reported, we've had cases in several bars and restaurants and in a private school. These have been patrons, workers, and students who were sick at the time they were working. One of those cases is Applebee's, and it also involves Digger Bar and Grill, where the exposures were between June 2nd and June 7th. Another high-risk case was in Office Bar and Bistro, with the exposure on May 22nd. A letter was sent to new case, and found a new case that was associated with that. And another situation arose in Ukiah Junior Academy where a student exposed people during the days of June 5th to June 10th. Mind you, these enterprises have been very cooperative, helping with contact investigation, contact tracing, in some cases, sending out letters on their own. But really, when a person is working there or attends a place sick, the cat is out of the bag for the rest of the community. And that's one of the reasons we've published um, our press releases to notify the community. So a concern is for mildly symptomatic people. They think they have their allergies or something very mild, which in another year would be fine, but they bring it to work or to school or to home when they're socializing. They're bringing it to their relatives and their friends. So at this time, especially during this surge, all symptoms should be considered COVID. Allergy should not be assumed. Stay home, test, and when you know you don't have COVID, then it's okay to resume your usual activities. Some who've been called refuse to talk with our contact investigation and contact tracing team. And these people are calling from the Department of Public Health to find out if contacts or cases need help or either in housing or in food. And they also want to know other people who may have been contacted and have the illness that we also talk to them. So I've released new orders to mandate cooperation with our contact investigation and contact tracing team when they call. We're also watching more closely these high-risk exposures in workplaces even before they become high outbreaks. And we're inspecting these for safety issues to discover them, to inform people, not for punitive reasons, but we need to bring our community back to a healthful situation. We've talked about variants in the past, and we know that several variants have been found in Mendocino County. The California variant was replaced with the UK variant, and we have seen a few of the Brazil variant viruses here in our county. These are more transmissible. They're not nearly in our county, as far as we know, as much as some of our neighboring counties, but the variants could be there, and they could explain our surge in terms of the numbers. What's important is that all of these variants are still responsive to the vaccines. So we need to get more unvaccinated people to test and to vaccinate. So let's turn to vaccinations in our county now. The supply is adequate, and the eligibility includes all those over 12 years old. This week is the state's call to action week to try and get as many vaccines out as possible by June 15th. The state also has the Vax for the Win incentive program, which has already awarded one Mendocino resident $50,000. 15 new winners will be announced today. The first 2 million people who get vaccinated are getting $50 gift certificates. And next week, 10 people will qualify for the final raffle of $1.5 million. And this will include people who've gotten vaccinated throughout the vaccination time, so all the way back to January. The county has 12 clinics scheduled all around the county using our traveling teams. Walk-ins are accepted, and we usually have a choice of vaccines available. If you have a group who's willing, no matter how small, we will schedule a pop-up clinic there. Note that for all who want to travel, don't forget the Johnson & Johnson vaccines. They are one and done, and you can be ready for the summer. If you want to check out the county's events, it's on our website, or call 707-472-2633, or you can call NCO at 707-467-3239, or you can call My Turn at 833 422-4255 or get onto myturn.ca.gov website. Primary pediatric and family medicine providers are beginning to distribute the vaccines in their clinics, either during your appointment or many even if you just drop in. The children and other vaccines are available and are going to be needed as the school year starts. And these can all be given on the same day. You may have noticed in Ukiah and Willits, we have billboards up. And also this week, 10 county-funded PSAs are being released by the Mendocino Diversity, Equity, and Inclusion COVID-19 Equity Work Group. These are extremely professionally done. People love them. I recommend you have a Kleenex available when you see the video. Vaccine distribution as of Monday included 84,378 doses. That is 64.5% of our population over 12 years old have been at least partially vaccinated. 54% are fully vaccinated. From an equity perspective, 61.8% of our lowest resourced populations are at least partially vaccinated. And our Hispanic population is 49.5% at least partially vaccinated, compared to 60.5% of the Caucasians. So they are catching up. It used to be significantly less, and we're putting a lot of energy into that community. In terms of age groups, the youngest, who are just starting to have their vaccines available, are already up to 29.4%, or at least partially vaccinated. However, those who are 18 to 49 years old are really slowing down, and they only amount to 54% are at least partially vaccinated. Now, perhaps this is thinking they cannot be harmed. They'll live through it. But we've had very healthy people under 30 in the intensive care unit fighting for their lives. Others may be putting it off. They just want to wait, or they don't have the time. And some can't get away from work. Yet the law says employers have an obligation to cover the time for vaccines during work or later. Most concerning are those over 50 years old, who are the most vulnerable and seem to have plateaued as a group at 75% vaccinated. Those extra 25% are some of the most vulnerable, and we really need to get them out to get their vaccinations. And remember, there are still some who cannot get vaccinated for medical reasons. So we encourage everyone to get vaccinated to protect yourselves and others in our community. We are relying more on the hospitals and clinics to give vaccines during this slower phase. And we hope to continue to do as well as we have in the past with our current clinics and the county events. As far as tiers go and the blueprint, we have been in the least restrictive yellow tier for 4 weeks now, but we have been in adjudication due to higher, more restrictive tier metrics. On June 15th, the blueprint tiers, the system for assigning industry-wide guidance, will actually be rescinded. This means more responsibility will be placed on individuals and businesses to protect ourselves and our community. And what does this mean? There will be no more state-determined capacity limitations, for example, gatherings, or physical distancing requirements. Masking is still an important protection, but we understand for people who are vaccinated, it's not needed except to protect others. And I want to just say that protecting others also protects our hospital and intensive care resources at this point, and really protects ourselves, all of us. So masking will be mandatory for all in certain situations. Those situations outlined by the CDPH include hospital and healthcare facilities, public transportation and transportation hubs, correctional facilities, congregate livings like in emergency shelters or cooling centers, And at this point, indoors in K-12 schools and childcare and other youth settings. Now, that may change when the school guidances are published at the state level. And some of these will also change when Cal OSHA publishes their final recommendations. For unvaccinated, in indoor public settings and businesses, they will need to use masks. So that includes government offices, retail stores, restaurants, family entertainment. So, what are businesses and hosts to do where masks are required only for unvaccinated people? There are three choices. First of all, everyone should be posting their requirements for all patrons. And then the options of what the business owners can do is they can continue to require all to mask inside their establishment. The second alternative is to allow self-attestation. In other words, question them at the door, and if they say that they are in compliance, they don't need to wear a mask, they can go without a mask. Or third, implement some form of verification system to determine, for example, you have to show your vaccination card or your test, or the state may find a vaccination confirmation record. They don't want to go with the word of a vaccination passport. They don't want this to be exclusionary. There still will be recommendations and requirements for mega events. For indoor events greater than 5,000, people will be required to show proof of a negative test or vaccination. For outdoor mega events, which are over 10,000 people, this kind of verification is recommended. And unvaccinated individuals are still recommended to use a mask if they cannot maintain 6 feet of distance from other people. From the point of view of travel, where the CDC is recommending following the CDPH is recommending following the CDC advice, and that includes for domestic travel, vaccinated people do not need to test or quarantine. And however, they should be masking, of course, during the transportation or in the transportation hubs, as I mentioned above. The unvaccinated should test before and after when they're moving around between states, and they'll have to quarantine afterwards. For international travel, there may be more restrictive guidelines, and I'd refer anybody to check with the CDC. Remember that no one can be prevented from wearing a mask, and we should not shame anyone or even assume anything about them. Many people, even after they're vaccinated, will continue to wear masks because the vaccinations for people who have immune problems or have certain medications or cancer, the vaccinations may not be as effective and they need to protect themselves more. There are ongoing exemptions for those under 2 years old, for those who cannot get vaccinated because of medical or mental health reasons, and there's some other reasons as well. But for these people, usually face shield with a bib can be replaced to cover the face. So in summary, we in Mendocino have been in a surge for about 4 weeks now, with more hospitalizations, more intensive care unit admissions, and more deaths. This may be plateaued a little bit, but it's hard to tell because the data is not clear with our testing numbers as low as they are. We're past graduations, but we'll see more and more effect of any gatherings as a result of those vaccinations over the next week or so. Upcoming, however, still is July 4th and Father's Day and the summer of gatherings and traveling, plus an increase in variants. Meanwhile, people want to feel that the pandemic has ended, and it has not. We must continue to test and do our contact investigation and tracing and use the tools of quarantine and isolation to protect each other. We need to continue to educate to keep masks on, and if symptoms, don't travel, don't socialize, don't go to work. We're working more closely with our hospital and clinic partners to get fully prepared for a larger surge. And please, everyone, vaccinate as soon as possible. Now is not the time to hesitate. And if you aren't vaccinated, enjoy the summer with other vaccinated people. And with that, I will close my presentation. Any questions? Please, I'll be here.
Thank you, Dr. Coren. First up, we're going to have Sarah with KZXZ.
Hi, thanks for having this. I'm wondering, with the reopening on Tuesday, and given that Mendocino is in a surge and we've had some cases popping up at a few businesses, will the county still be allowed to impose restrictions?
Oh, that's a good question. The county would be allowed to impose restrictions. I don't believe that they will help at this point. I think people know what they need to do, and the restrictions that there are put on by the state are the best for, ourselves, taking care of ourselves and each other. I think the key is that we need people to get vaccinated, and for those who are still vulnerable, they should be wearing masks. And for those of us who are vaccinated, I would recommend continuing to use masks indoors.
Okay. And you mentioned that you were going to mandate cooperation with contact tracers, and I'm wondering how that's going to be implemented.
If people refuse to cooperate, they would be liable for citing and fines, and so that's really what we would probably use. Sarah, I don't think that we are looking for finding people out and putting them in jail or finding them. We want to make it clear that this is the law. People really need to do this. It's not optional. It's necessary to protect our community.
Thank you.
Thank you. Next up is going to be Mendocino Action News. Danilla.
Good afternoon. Thank you for having this meeting. My question has to do with, you had said our 50th death was a female that was over 80, that was in ICU for some time. Looking back at all 50 fatalities that we've had over the last year or so, could you give us, an average number, or how many had comorbidities? I believe that all were over 55, for example. Could you give us a little bit more information regarding that?
I don't think I can give you that data right now. I can work on that some if you'll send that in, but I don't have all the data, and that's a good question.
All right. My other question is, when you just recently said most of the cases recently were vaccinated, that kind of left it vague that possibly, or excuse me, unvaccinated, that possibly some were unvaccinated. I know in the beginning there were 16 cases. They used to be called breakthrough, and now you're calling them post-vaccine cases.
Right.
So, do we have a new total?
Yeah, the newest total for our county is we've had 30 out of 47,000 people who have been vaccinated. So the number of people who've had a post-vaccination case is 6 per 10,000. And those hospitalized are 4 per 100,000. So the vaccines work, but there are going to be some people who are going to potentially get sick after they've been vaccinated.
And if I could, since that first question wasn't really answered there, out of those that had got COVID after being vaccinated, is there something determining a factor? Did they not wait long enough after the second dose? Were they hospitalized to a severe situation, or were the symptoms less?
The symptoms generally were less, but we do have someone in the ICU now who is status post-vaccination and is elderly and does have some other what we would call comorbidities. The people who are getting the illness after vaccination tend to have many more comorbidities, and some of them may mean that the vaccination is not having as much beneficial effect as in other people without those illnesses. And we've known that. So this is not unexpected. It is always unfortunate. Did that answer your question?
Yes,
No.
thank you.
Okay.
Thank you. Next up is going to be Matt with mendofever.com. Matt, are you with us? All right, not hearing anything. We're going to move on to Mendo Voice. Adrian.
Thanks, Trevor. Dr. Coren, I was wondering, correct me if I'm wrong about the terminology, but as I understand it, the Indian variant is now being called the Delta variant. Maybe there was a second Indian variant that's called the Delta variant.
No, the Indian variant is being called the Delta variant now.
So I was reading the other day that the breakthrough rate or the post-vaccine rate is in the low single digits for the normal variant. It might be in the double digits, around 15% for the Delta variant. I saw that. I'm not saying that that's, but given that, when do you think should we be expecting booster shots to inoculate us against these new variants? Is that in the pipeline? Is that something that there's been any discussion of a timeline for?
First of all, percent of these infections post-vaccination are really much less. So I'm not quite sure. So before I answer that, I want to make sure it's clear that the percent of cases after vaccination in our community are 0.0625%, and hospitalized are 0.004%. So significantly less than 10 or 15%. Let's just be very clear about that. And then what was the second part of your question?
The second part was that, so it was
boosters.
Well, I guess I'm asking if you have a comparison between the Delta variant and the ordinary variant, but if not, will there be boosters? Is that something we should be expecting? Is this something that we should sort of be normalizing in our lives, that we should just expect every year we're going to get a COVID booster?
Well, we've gotten used to that with the flu, and we realized that, certainly with HIV, that the multiplication, the faster it multiplies, the faster the contagion is, the more likely there's going to be mutation, and the more likely you're going to need boosters with some changes in those boosters to cover the new variants. With COVID, the current vaccines are producing a tremendous immune response. And so far, it looks like their immunity is out to 9 months, as far as we can see among those who were in the phase 3 trials. And they're not seeing a lot of immune decompensation. So I have not heard that we're expecting boosters because they're being less effective. While the Delta variant, the India variant, is more transmissible than, for example, the UK variant, which was the Alpha variant, and that was 50% more transmissible than the native COVID. It may have a slightly more resistant to the vaccine, but it's really not a lot. And so my understanding is that the vaccines are still very active against all of the variants we've seen in the United States. There may be some decrease, but it's not significant in terms of affecting the population. I think when we have a little bit more time with this vaccination on board, we can see if the immunogenicity or the immune resistance wanes, and then there will be a need for a booster. And I'm sure that the drug companies are thinking up new ways to kill the variants. So when they have to have a booster, they'll have one that's also capable against those variants. But right now, the short answer is I have not heard talk of either developing a booster or when it might be circulated. So the one we have is good. Let's get it.
And I also wanted to ask, earlier in the pandemic, there was a fear that if we dipped under a certain number of doses, tests per week, that we might have the testing pulled from us. Is that a risk now, given how low the testing rate's gotten?
Oh, that's a good question. Because we're in the situation we're in, I've actually had a conversation with the people at the state level, and we're not only keeping the testing that we have, but we're also continuing to have access to the state level volunteers who help us with contact investigation, contact tracing. And they have made it clear that if we need more help with testing or with vaccinations, they would step up. But at this point, our county teams are doing a fantastic job, and we have more in store and more planned to go forward. We just need people to come in and get their tests and come in and get their shots.
Thank you, Adrian. I'm not seeing any questions from the public at this time, so I'm going to go back through the media one more round and see if you guys have any more questions. So starting off with Sarah, KZYX&Z.
Yeah, I'm wondering if you could go into some more details about what it means that our status is being adjudicated.
Yes. So the state had strict metric numbers to decide what color tier they would put us in. And we were among the first to achieve yellow tier metrics. That was case rates, test positivity. They also looked at some other issues, how many were in the hospital, what our hospital capacity was, how we were doing with vaccination. Anyway, we were in the yellow tier. As this surge kicked in, our case rates went up, and our test positivity went up. Our vaccination rate continued to be very good, and our testing rate, though it came down, we actually are utilizing our state provided resources better than other counties are doing. And we have, thank goodness, the capacity in our hospitals that the burden of the disease is not excessive. And for that reason, they said, hey, let's not move them back to orange or red yet. And I think as they're winding down and getting us to the beyond the blueprint, I think that they don't want to move any of the counties back. You know, if they were to move us back, they would only, according to the rules, move us back to the orange tier. And if you look at what's available or what's restricted or not restricted, the difference would not make as much of a change in our county's activities. And so we've been doing an enormous amount more messaging, making our vaccines available, testing available, and a lot more contact investigation and tracing. But it was adjudicated because they said, hey, you know, you guys are not where the metrics ought to be, but we don't want to move you back yet. And that happened to several counties. And in the earlier days, during that adjudication period, the county health officers often went to the California Department of Public Health and pled their case and so on and so forth. It really wasn't necessary for us at this point. They said, stay in yellow. But we still needed to keep the case rates down, the vaccines up, and the testing up as much as we could. And that's what we're doing.
So it was a conditional pass, basically.
Correct.
Okay, thanks.
Do you have a follow-up?
No, that's it. Thank you.
All right, thank you, sir. Next up, Mendo Action News, Danilla.
Yes, thank you. So my question is about schools. I was reading that when we reopen, that one of the changes could be at school K through 12 that you'd be wearing masks still inside, but not outside. And then you also said the guidelines have yet to come out. And I've also noticed that graduation has looked a little different this year. They've been able to have a larger crowd and modify, and a lot of the students have had vaccines and staff as well. Do you believe that school's going to look like that next year, or how do you think?
What I'm told is at this point, the CDPH is recommending all schools from K to 12 and childcare and youth settings indoors, everyone would wear masks. Now that may change. The school guidance has not been finalized yet. So even as Dr. Aragon, who's our state director of public health, Even as he wrote these up, he said, this is still a question. And if I didn't make it clear before, the state's Cal OSHA recommendations have not, as far as I can read, have been finalized. So it's been very confusing the last 3 or 4 days. And so I'm not going to try and give you the answer. I'm going to give you as honest an answer as I can.
Understandable. Thank you. Just a quick recap of what you said. There's been some cases recently at bars and restaurants of people showing up with symptoms and still going to work. And you had said, how you could prevent some of that is testing when you have these symptoms. A lot of people, as we're going into spring and summer, are having allergies. So is there anything that you could add on to that?
Yes, thank you for the question. I have allergies too. I get my sniffles. I did get vaccinated. People who think they have allergies oftentimes have a mild cold in the past. Now that mild cold may be COVID, and it could travel through our community and kill someone. So my advice is if you're not vaccinated and you have symptoms, even if they're as mild as your allergies, get tested and stay home until you know the results of the test. That's our advice. I know that seems like, oh my gosh, but most people will know, if their antihistamines aren't working or their nasal spray that they take for their allergies, this could be a cold, and they should be very cautious because it's not like an allergy, which is not contagious. We're in a situation where COVID is very dangerous and they could be harboring it. Many people don't even know they have the symptoms and they're passing it along. So if you have symptoms, treat it if you think it's an allergy as you would an allergy. And if it's not better or things are getting worse, stay home, get tested. That would be my advice.
Thank you.
Adrian, Mendo Voice, you have a follow-up question?
Yeah, Dr. Coren, I want to be, I don't want to say that the pandemic is over by any means. You make that point frequently, but I think that we have a little bit of perspective and distance from where we were at the beginning. And I'm wondering if you could comment on the death rate for confirmed cases in Mendocino County is like 1.2 or something percent. Is that normal? Was that higher or lower? And do you have any reasons why that might have been?
It's in the range of others. It may be a little higher than some of the surrounding counties, and I don't have a good reason for it. You're talking about the number of deaths per population or the number of deaths per people who are hospitalized. And we've looked at that, and it's not that significantly different, and we can't find any reasons for it either.
It could just sort of be normal statistical variation with a fairly small sample size.
Yes, yeah, we have a small county, and so when we compare ourselves to some of the much more populated counties, it's a little hard to know whether ours are really solid numbers.
Thank you.
So we're still not seeing any questions from the public. So if you would like to do one more round of questions, we have about 10 minutes left. I can just go through the list one more time. Sarah, do you have any questions?
Nope, I'm done. Thank you.
Okay. Danilla?
Yeah, just another recap. Dr. Coren, you said that people that are vaccinated could go in certain environments without wearing their mask unless they are living with someone vulnerable at home. Can you explain why that is?
If people are vaccinated, they themselves are very well protected, but they may be able to transmit a virus without getting infected to someone who's more vulnerable at home. And that's the point I'm saying, is to be a little bit more cautious. If you yourself have some, for example, immune deficiencies, or if you're getting cancer chemotherapy, then you yourself should be cautious, and your family members should also be a little bit more cautious. So at this point, we're doing well with vaccinations, but there's in the range of 40% of our population out there who's not completely vaccinated. Many will have some infection and be asymptomatic, and we don't want to carry it home to our more vulnerable elders, people who are have some illness, or even the children.
Thank you.
Mendo Voice, Adrian, you have a follow-up?
Yeah, and I came in late, so I'm sorry if you covered this already, but I'm wondering what the standards are going to be at evacuation centers this summer when the fires come. Well, what is the last year we luckily didn't have to do any major evacuations. There was actually Brook Trails did, but I think it was, I don't remember. But this, if we do have a substantial evacuation, we have to set up evacuation centers across the county, or if we're taking people in from Sonoma County, as has happened in past years, what are those evacuation centers going to look like? Do we have a high enough percentage vaccinated that actually restrictions will be fairly minor, or are we going to have to do something more complicated like last year?
The recommendations from CDPH will be that everyone will have to be masked in emergency centers like the shelters, and in some situations there'll be cooling centers that will be needed. Any congregate living facilities, those recommendations will be for everyone to be masked.
But if we have to set up, I remember last year there was issues if there had to be overnight. People had to go to an evacuation center overnight. Traditionally, you might set up cots. Last year, that wasn't an option. They were looking to get people hotel rooms. This year, would it be cots again, or would it be more of a traditional evacuation center? What kind of capacity is the county and the state going to have to respond to that?
We'll respond, to the extent that we need to. The only recommendations that have so far been made that I've seen is on masking for those centers. So it will not depend on whether you are vaccinated or not. You'll need to wear your masks. So far, the recommendations for social distancing within those centers has not been an issue. It has not been identified, except that the Beyond the Blueprint advisories have said there'll be no more social distancing requirements. We may change that if it becomes an issue. We still think it's safer in general for people to keep some distance between their cots. And so for that reason, we usually arrange them head to toe, and we leave a certain amount of space in between. It's also more comfortable for people.
Thank you.
All right. We have about 5 minutes left. If there's any follow-up questions, otherwise we can wrap things up. All right. Hearing nothing, that sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren an opportunity to give some concluding comments.
Thank you. Well, I'm glad I've been able to answer the questions of the press. I just want to emphasize that we are in a surge at this point. The numbers may seem smaller, but when you look at it from the point of view of the testing being decreased, but the hospitalization and ICU numbers are very high, you realize that this is a surge and that it is especially affecting a much narrower cut of our community, which is those who are unvaccinated. So we want to continue to advise testing, because without testing, we can't catch these outbreaks before they come through. We want to especially advise that anyone who has symptoms, even minor symptoms, that they should get tested and stay at home from work or school or even sports and fun until they know that they are without this COVID virus, so it doesn't affect the whole community. And on our part, we'll continue to do the contact investigation and tracing. And we want everybody out there to understand that we're doing it for their good, because if they need services, we want to be there to help them, and for the good of the community. And in the meantime, as the rules come down after the blueprint is closed, keep your masks with you, and ask everyone else to keep their masks with them. There are certain indoor environments that everyone will have to be masked, whether you are vaccinated or not. And in some cases, there may be a choice, either for the person who runs the enterprise or for you. But let's try and keep ourselves and each other as healthy as we can, and get vaccinated until we get beyond this pandemic and live safely and more normally in the future. So get vaccinated. If you have any symptoms and you haven't been vaccinated, get tested. And if you're vaccinated, have a good summer.
Thank you, Dr. Coren. Our next update is scheduled for June 25th. Please continue to follow Mendocino County Public Health on Facebook and Twitter for all COVID-19 updates. Thank you for joining us and hope everyone has a great weekend.